Good morning, everybody. Once again, your friend Dr. Salim is here. Today, I want to talk to those doctors. My message is specifically for those healthcare providers, specifically if they work in a ultrasound department, or you can call it radiology department, or maybe cardiology department. The one who are scanning and they use the ultrasound or sonography. They do that. If it's echocardiography, vascular Doppler, general abdomen, MSK, TCD. I mean, they hold the probe and they're scanning. So my message is for them specifically. The topic is, which is very important, we all know this, it's about the artifacts. Sometimes we get artifacts and which is not a real picture, it's just an error, it's something is missing, and then we present it as a pathology, and then maybe the next step is surgery or maybe a procedure. When they open and they look to the next step, they go, they don't find what our finding was. So to avoid from this kind of problems, there are a few things to keep in mind. Let me share with you guys. For example, we said, what is artifact? First of all, what is the definition of that? Maybe if somebody want to sit for one of the SPI exam or ARDMS or somewhere else, some other board exams. So maybe somebody can ask you this question, or maybe you're a trainer, or maybe an interview question, somebody can ask you, what is artifact actually? So we can say, artifact is actually an error in the imaging which appear in one of the plan and disappear in the other plan. If you're scanning a patient with a sagittal view or sagittal plan and you see something but it disappear and the transverse, or if you see it with a short axis or transverse view but it disappear in the long axis or the longitudinal view or plan, so it means that is artifact. That's not a real anatomy or pathology. You don't see, actually there is not real such a thing. So now let's go a little more with the detail. If somebody says, I need a little more explanation, I couldn't get it, what is artifact again? We say it is something is actually missing, which is missing means it's not there. So that's something is supposed to be there but you don't see it. So that is actually missing thing. Maybe something is improperly located. It's not in the real location it's supposed to be. It looks in a different location, one of the anatomy structure or any organ. Or maybe it's really brightness is not properly. It's supposed to be hyperechoic, but it looks hypoechoic. Maybe it's supposed to be anechoic, it looks hyperechoic. So the brightness is not proper, we can say. The shape and size of the anatomy is not correct. The shape is weird shape. It's not a normal shape. Even the patient have no pathology because you see the structure in the transverse plan, but you don't see it in the sagittal plan again. Or maybe we can say it is also not matching with the anatomy. It's totally different from the anatomy. So these are a few things. And also, for example, maybe somebody will say, what are the other, like we said, what are the causes? What can cause these things? So we'll say there are a few causes for this. The cause number one, we can say, for example, we say violation of assumption. We all know the sound work in a rule regulation. If the sound is not going, it's supposed to go on the specific rules regulation. If they violate, if they cross the borders, then they will give you artifact. Then that will be the punishment. We will get the wrong information. So assumption, violation, that's one thing. That's the cause of the artifact. Secondly, maybe the equipment you're using, they are not properly working. So it's a malfunctioning of the equipment. The third one, if you are the preliminary person and there's another person who is after you, you scan a patient, you collect your primary information, or we can say preliminary report or your findings, but there is somebody else who put the final diagnosis and they finalize your report. Maybe it's either your fault because of the experience, too much rush, your patient is not cooperative, so your findings have a problem. You did not explain it well. That's also artifact. It count in an artifact because of our, like if you are the one who just put the preliminary or the findings, I can say, the primary findings. Or it can be the problem of the interpreter doctor, the one who is maybe a cardiologist, radiologist, internal medicine, the one who is after you put the final diagnosis. So the one who put the final report to sign it. Maybe they did a mistake. Now, quickly, let's come to the violation of the assumptions. There are 6 rule regulations. If sound go against these rules, we experience the artifact. So number 1, for example, like we can say the sound travel in a straight line. If the sound, it's the rule, it's the regulation for the sound, it has to go straight in a straight line. Just in case if the sound do not go in a straight line, so it means it's violating a rule regulation. It's not, it's bending. For example, it's supposed to go straight, but it's just bending. That bending will produce artifact. Like for example, I will just give you an example like 8 shadow artifact. The sound just bend. So that's one thing. For example, the second one, we said the sound travel directly to the reflector and come back from there. What's the example of that? For example, we have range ambiguity artifact. The sound, that's the rule of the sound in principle 1, that's the rule regulation. The sound has to go in a straight line, and that will go all the way to the area where they hit anatomy and reflect back. So the next pulse is not emit or fire until they get the information from the first pulse. So sometimes what happens, it is the violation that a premature pulse is coming. So the second pulse come before the first one take the information to the point. So they meet in the middle way, and then they just receive this information. So the second pulse take the information from the middle, from the halfway, and take it to the processor. And they tell them that I got the information from here. And they represent the information from the wrong location. It was from the bottom, for example, the cyst. It was from the bottom of the cyst, but they met in the middle of the cyst, the second pulse and the first one. So the second one took the information, and that will represent in the middle of the cyst. And now we get, and that's the artifact, we get the information from the wrong location. So that's assumption number 2 was violated. It's not going to the reflector, it just came from the halfway. The third one, the sound has to travel exactly in 1540 meters per second in a soft tissue. That is the propagation speed of the sound in the soft tissue. If this sound travel either more than this speed, and it means it go faster, or if it goes slower than this speed, you will get artifact. Specifically, this is very important when we do any biopsy procedures. When you do biopsy of something, so we can give the wrong information to our surgeon or the doctor who just take the pathology, who take the biopsy from that area. So be careful with that. Do not use a window where you don't see the correct echo texture for all. Like it has to be homogeneous, everything where you send your sound from. Use that window which can reach to that area where you are taking the biopsy from. All the sound has to go travel on the same speed, and we will know if the cyst come in front of your sound waves, that will give you the wrong information. If a structure which is very brighter structure that came in front of your sound wave, so you're taking biopsy from the bottom area somewhere on that brightest or that anechoic area below that will give you the wrong information. So use a different window. So that's the third one. The fourth assumption is if it's violated. For example, the fourth is, we said everything we see, the real picture is it has to be in the main axis beam. If you see something which is on the not on the main axis, it's off axis beams, those are also not correct. That is actually you get reflection from the wrong location, and that is actually, we can call it, that is one of the artifact we get, off-axis beam artifact. So your lateral resolution become wider, and that give you the wrong information. That was number 4. Number 5, we said the imaging plan is very thin, very thin. If it's become wider, we get artifact again. So that will also give us debris from the tissue walls inside of the cyst. For example, if you're scanning a cyst, so or maybe urinary bladder. So from the walls, you get the information in the middle of the urinary bladder or cyst. So that is also, if your scanning beam is wider, you get that information. So that's again violated something. Number 6, we said anything we get back the reflection, it has to be represent that hardening or softening of that tissue where the reflection come back. If that don't match, it means that is a violation of the ultrasound sound beam, we can say, or the sound rule regulation is violated. The example of this will be what? Like, for example, when we scan an assist, like if you want to scan a cyst, a fluid filled structure, so you see below that, you see a hyperechoic area, which we call it artifact, and that artifact is what? Posterior enhancement. So the posterior enhancement is actually, it was fluid filled structure, it was a weak attenuator, that was a weak attenuation, and you get hyperechoic, so that does not match. It's supposed to be shadow. Why I see brightness? So it means that was one of the artifacts. They are not matching. So these are all the causes of the artifacts. So I hope that will help you. If you have any question, so please let me know, or you can put it in a comment. And one suggestion from all the weavers, all these friends, all those healthcare providers, please do not forget to share these if you think this is beneficial information for somebody who is in the ultrasound field, radiology, cardiology. I mean, they deal with this kind of information. Please don't hesitate to share with them and tell them, or you also, and also they tell them, if you know them, to subscribe. And also, if you didn't subscribe me, please subscribe and wait for the upcoming videos. You will get a notification if you subscribe. Thanks a lot and have a good day. See you guys in next video.